going to talk about the kidney failure, which is the last part for chapter 13 lah. Okay, if kidney is malfunctioned, the body fails to maintain the amount of glucose and amount of glucose and salts in blood, or kidney cannot remove it, urea. So this urea, they are remaining in the body so they will eventually build up and become toxic and fatal. So we have to have few kinds of treatment for kidney failure. So the first method is dialysis. We use the dialysis machine to treat this kind of patients . So when they ask you to describe, you can use these few points. First point, blood is taken from blood is taken from veins from arm. So your arm here, this one here. Here. They will take blood out, and then this blood will travel through this dialysis machine, and then in this dialysis machine they will have this dialysis fluid which contains glucose and ions, and the dialysis fluid and the blood are separated by partially permeable membrane. So this one you can relate that to chapter 3, diffusion between blood and fluid. So urea will move, but in exam we use the word diffuse from blood to the dialysis fluid, while glucose and other ions, since the level of the glucose and ions in blood is actually similar to the fluid, so no net movement occurs. Actually, some of the glucose and ions still from the blood still move to the fluid, some from the fluid still move to the blood, but there's no which one like more or less both also same. And then same, how to say the amount of movement from both sides is the same. Clean blood then exits the machine and re-enters patient arm. So after the blood is filtered, we let the blood flow back to the patients Okay, so this kind of treatment they have advantage and disadvantage. So the advantage is you can do it without kidney donor. So without kidney also never mind. Disadvantages is you have to do 3 times a week. It means that you have to always go back and do Then this will be difficult for patients to carry out normal lifestyle, and hence lowers the quality of life. Okay, let me wrap off everything first. Okay, let's move on to last part, kidney transplant. So for kidney transplant is we have to get a kidney donor to donate the kidney and then we insert the kidney into the patients. Okay, so this one you only have to know the advantage and disadvantage. So advantage, long-term solution, and then can live a normal life after recovery from the surgery, and you don't have to do dialysis. Disadvantages is to find a suitable donor, it takes time and quite hard also, and the cost for operation very expensive. And then why is it hard to find the suitable donor? Because there might be a rejection risk. So sometimes your body will reject the kidney, so it's hard for kidney transplant. And then some of the religions, they actually forbid this kind of surgery also. So that's all for chapter 13, and then during class we'll do some practices and then we'll move on to chapter 14.